Hello everyone. Today we'll talk about HbA1c. What is HbA1c? What does this test mean? How it is done? Why it is done? And what is the difference between random blood sugar and HbA1c? How to interpret its results? Who should get this test done? How frequently it is recommended? And how to normalize HbA1c percentage? All these basic queries will be discussed today. So the first question is, what is HbA1c? HbA1c is glycated hemoglobin. In normal condition, hemoglobin carries oxygen, but in presence of excess glucose, for a prolonged time, this hemoglobin becomes glycated. The second query is, what does this test mean? By this test, we can measure the amount of glycated hemoglobin in the blood of a person, which gives an overview of patient's sugar control for last 2 to 3 months. How this test is done? This is a blood test in which your blood sample can be taken anytime. Next query is, why it is done? This test signifies the efficacy of treatment, diet and lifestyle modification. The lower the value of HbA1c means the higher efficacy of measures adopted for sugar control, whereas the random blood sugar tells us the glucose level of that particular time only, which varies significantly with meal and meal timings. Apart from this, it is being used to assess the risk of diabetes in normal individuals. Next is, who should get this test done? All diabetic patients should get this test done regularly. Anyone who is above 30 years with a positive family history of diabetes, overweight and obese people following a sedentary lifestyle are always at a risk of developing diabetes. Next is, how to interpret its results. In normal individual, the value of HbA1c should be less than 5.7%. If HbA1c value is between 5.7% to 6.4%, it indicates the higher risk of developing diabetes, which is generally termed as pre-diabetes. If HbA1c value is more than 6.5, it means the patient has diabetes and it is recommended to maintain this value below 7%. In any circumstances, if this value is higher than 7%, there is a risk of diabetes complications like kidney disease, nerve disease and other problems. Next query is, how frequently one should get this test done? On an average, a diabetic person should get this test done after 3 months for close monitoring of glucose control. How to reduce HbA1c percentage? By adopting diabetic diet and following an active lifestyle with or without medicine depending on degree of severity, one can reduce HbA1c percentage to a safer zone. A small change can bring great results. Thank you.